program of useful relevance. The job opportunities for this program is tremendous. They can work as environmental health and safety specialist, occupational health and safety specialist in various organizations, HSE coordinator and protection officers. They can also work as worksite wellness coordinators, public administration and safety professionals. They can also work as industrial hygienists and ergonomists in the various organizations. Then the safety and environmental health managers, toxicologists, health and safety engineering specializations are also very important. The objectives of this program include the following. They will discuss the impact of the environmental hazards on human health. Then they will describe the policies, laws, standards and the measurement techniques and applications in different occupational setups. They will also help to develop mitigation strategies to contain and manage environmental and occupational hazards for positive health. Finally, they will also help to exhibit the knowledge and skills that are needed to improve the environmental sustainability of human health systems. Hello viewers and learners of the Postgraduate Diploma in Environmental and Occupational Health and Master of Arts in Environmental and Occupational Health. Welcome to this session. Along with me is Professor Shubhangi Vaidya from the School of Interdisciplinary and Trans-Disciplinary Studies, and welcome to this session, ma'am. So today we are happy to introduce a new course in this program with the course code MEVE 005. And the course title is Disability Studies and Occupational Health. Now, often we have seen that the workplaces can be hazardous for people. For example, you can have the chemical hazards or you can have certain physical hazards, and also as the workplace itself can be hazardous due to the occupation itself or due to various other reasons. And this has resulted in the problems related to disability. For example, if there are chemicals, the person could be exposed to certain kind of chemical burns. Maybe the eyes could be affected, the skin could be affected, or even the slip and falls, which are very frequent due to the wet floors. And also in the occupational hazards associated with certain industrial sector, for example, in the painting of the dials, that is in the watch dials. Here again, radioactive paints were used before, and many people had the disabilities and problems related to this. So hence we thought that this course would be very useful, and we have introduced a course that is MEVE 002, Environmental and Occupational Hazards, where we have discussed about the various environmental hazards, the natural hazards, and also the occupational hazards and the effects that they have on the people, and especially in the specific workplaces. So in relation to this, we thought that we can have another course related to disability and occupational health, and how we could include the persons with disabilities in the workplaces, and we can create the inclusive and accessible workplaces where within these workplaces they can also thrive and also contribute to the economic development of any nation. So that was the motive behind this, and of course I would now ask Professor Shubhangi Vaidya to discuss the rationale and the relevance of this program, and also discuss about the structure and the contents of this entire course. Over to you, ma'am.
Right. Thank you so much, Dr. Sushmitha, for giving a very, very comprehensive introduction as to why we felt in SOITS that this course was necessary. So as you have rightly mentioned, there is an entire course in the program which is devoted to environmental and occupational hazards. But the focus of this particular course, MEVE-005, that is Disability Studies and Occupational Health, is more related with how persons with disabilities can be included and accommodated in specifically the workplaces. So we are looking at the way in which disability is a very, very important societal issue, that disability is not just a consequence of any physical or intellectual difficulties that an individual may have, but how the way in which society itself is structured can cause profoundly disabling impacts for individuals. And hence, it was decided to look at this particular issue, not just from the perspective of health and hazards, but to also look at it in terms of how accommodations, inclusion, disability management at the workplace, and so on, can be fostered. And it's interesting to note that in the joint ILO and WHO Committee on Occupational Health, it defines occupational health in terms of maintenance and promotion of highest degree of physical, mental, and social well-being of workers in all occupations. And it also speaks of placing and maintaining the worker in an occupational environment which is adapted to their physical and psychological capabilities. In other words, it speaks of the adaptation of work to human beings and of each human. It has been said that exclusion of persons with disabilities from occupational settings, along with inaccessible built and social environments, is a very important social justice and human rights issue. Apart, of course, from the economic issue, because they can considerably contribute to the country's economic progress, as you've mentioned earlier, if their capacities are recognized and strengthened. And therefore, there is a need for suitable adaptations and accommodations at the workplace that will benefit both workers and employers, and therefore will make a better and safer working place for everybody. And it's important to note here that an accessible, inclusive, and safe workplace is not just something that will benefit persons with disabilities, but it will benefit all workers. And not just will it benefit workers, it will also benefit employers, because when your workforce is well looked after and productive, obviously this is going to lead to increased profits and a better name for the business or the industry. So let's look now at the structure of this course. Now, this is a 4-credit elective course, which is structured into 4 blocks and a total of 13 units comprising the 4 blocks. And we'll go block by block. The first block is titled Introduction to Disability and Disability Studies. In block 2, we speak of issues of health and access. Block 3 refers to disability, work, and employment. And block 4 pertains to the legal and policy frameworks which center around disability and disability-related issues. So let's look at it now block by block. So the first block, Introduction to Disability and Disability Studies, comprises 3 units, and I'll just mention the salient features of each of the units. The first unit, Unit 1, is a very important introductory unit in which we actually explain what we mean by the term disability. So by disability, we mean an individual's physical or mental condition, but not just as a medical concept or not just as a medical feature, but also something which impacts with disabling features of the environment. So if the environment is disabling, an individual's impairments or the difficulties and challenges that an individual may face in terms of their physical and mental functioning, they get amplified. Whereas if the environment is an adapted environment, the environment is inclusive, the environment is built to accommodate the needs of persons with disabilities, then they can function in a much more optimum and comfortable manner. To give a simple example, if there are ramps in buildings, wheelchair users can access these buildings with greater ease. If there are no ramps, if there are no lifts, then it becomes very difficult for them to access these spaces. And then we think that just because a person is a wheelchair user, he or she cannot study, he or she cannot work, and so on, which is not the case. The problem actually is with the environment and not with the individual's physical condition entirely. So in this first unit, we give an overview of the universal nature of disability. We speak of some of the important definitions of disabilities. We look at the causes and classifications. So we look at disabilities of all varieties: physical, sensory, intellectual, psychosocial. And we also look at disability in a global context as well as specifically the conditions in India or the specific issues of persons with disabilities in India. So by engaging with this unit, you will get a very good idea of what exactly the issue is, how disability can be perceived, and the issues and challenges that are experienced by persons with disabilities in their everyday life. We move on next to Unit 2, which speaks of the evolving perspectives on disability. Now, disability is a subject area which is evolving in terms of its theoretical and conceptual frameworks, and new understandings of the way we look at disabilities have emerged over the last half century or so. So basically, we're looking at the changing meanings of disability from a cross-cultural context, because disability manifests itself differently in different cultural contexts and is seen in a different way depending upon the cultural background of that particular place. So, for example, if it is an agrarian society where primarily the work is manual in nature, a person with physical disabilities may experience far greater difficulties than, say, if it is a society or a place which is based on white-collar jobs mainly, where the physical disability will not be as significantly felt. So we look at disability as a cross-cultural phenomenon. And we also look at the various models or ways of looking at disability that have existed across history and through cultures. So we speak of the religious model, the charity model in which persons with disabilities are seen as recipients of charity, and that disability is seen as a pitiable condition. This has been largely a dominant perspective in the world of disability. But from there, we also speak of the social perspective, that is the social understanding of disability as something which is really a product of societal conditions, a product of inaccessible environments. The medical model, of course, which has been one of the most important ways of looking at disability, is also discussed in detail. And then we also speak of the current human rights model, which looks at disability as a very important human rights issue. So these are some of the broad perspectives on disabilities that we tackle in this particular unit. And we also look at intersectionality. By intersectionality, we mean the way in which disability really intersects or interacts with other categories of marginalization, most importantly, gender, caste, and so on. So it is well known that women with disabilities experience a host of issues and challenges that perhaps men with disabilities do not to that extent, basically because they are women. So the issues that women face in a patriarchal society, plus if they happen to be having disabilities, these get compounded or amplified. So we look at intersectionality as a very important factor in disability studies. The third unit, disability, development, and environmental factors, places disability very, very firmly as an issue of development. So when we talk about development, and if persons with disabilities are left behind, if they are not able to participate in development to the extent that non-disabled persons are, then obviously that development is something that needs to be worked upon. Here, very importantly, we discuss the Sustainable Development Goals, the SDGs, and how within most of the SDGs, even though disability is not mentioned specifically as one of the 17 SDGs, we see that it is actually an intersecting or cross-cutting issue, a lot like gender is. So you cannot speak of education for all if you do not include persons with disability or children with disabilities. When we speak of workplaces as important SDGs, you have to also consider the issues of persons with disabilities. When we speak of health for all, when we speak of equality, when we speak of eradication of poverty, all these are some of the important SDGs. And persons with disabilities are a very, very important constituent. And therefore, the whole idea of leaving no one behind, when we say leaving no one behind, we also mean that persons with disabilities should not be left behind in the entire discourse of development. We also look at natural and built environments. So I've just mentioned earlier that the built environment very often can be inaccessible and therefore increase or compound the issues experienced by disabled persons. But also, very importantly, these days there is a lot of discussion around conditions like environmental degradation, climate change, disasters and disaster management, and their connection with disability. So studies have shown us that climate change is experienced more acutely, is felt or is experienced in a more adverse manner by sections like women, children, persons with disabilities. In situations of disaster, they are usually the ones who are abandoned or left behind or have difficulties in accessing relief measures. So when we talk about environment, we are including all these dimensions and therefore giving you a very rounded and holistic view of the way in which disability, environment, and development are interrelated. So much for the first block, which is basically an introduction to the whole course. We then move to the second block, which is issues of health and access. Now, in this particular course, we are primarily looking at disability in terms of health and in terms of employment or work, the worlds of work and the worlds of health. So it's very important for us to understand the health-related issues. The fourth unit, Unit 4, speaks of disability, health, and equity. So health equity means the capacity of each individual to enjoy the optimum possible health, and how persons with disabilities are very often denied the opportunity to access health facilities. There are barriers towards access towards health, and also their health-related experience we discuss in some detail so that you get an understanding of what some of these issues are. Unit 5 speaks of a concern which is really a global concern and something that has particularly become amplified in the post-COVID era, that is the issues of mental health and well-being. So mental health and well-being of persons with disabilities, particularly at the workplace. So the work environment has a profound impact upon mental health. And here we discuss some of the strategies that can be used at the workplace to improve the mental health of employees with disabilities. And the sixth unit, assistive technology, speaks of the role and importance of assistive technology for persons with disabilities. And this is particularly important in the context of the workplace, where access to appropriate assistive technology can make a huge difference to the workplace experience of persons with disabilities. So how the workplace can be adapted, what kinds of different tools, what kind of different technologies can be made available to persons with disabilities so that they can function in the optimal manner possible at the workplace. These are discussed, and we also give case studies of specific types of disabilities and the way assistive technology can help persons with disabilities or with these specific disabilities. Block 3, the third block, is really at the core of this course. This is really the heart of this course, in which we talk about disability, work, and employment. So we have 4 units in this block. Unit 7, Disability and the World of Work, gives you a broad overview of the issues and challenges of persons with disabilities in work and employment. We look at it from a global perspective as well as specific experiences in the Indian context. We consider issues of inclusion and accommodation, and like I've mentioned, the specific experiences of workers with disabilities in India, whether it is in the unorganized sector, whether it is in the organized sector, or also in the upcoming or in the sector which is very, very dominant at the moment, which is the gig economy and so on. So we look at these issues and challenges in a broad context of work and employment. Unit 8. Now, this is once again related to Block 2, the unit on accessibility, which we spoke about in Block 2. So these units can really be seen together when we talk about universal design and changing workplaces. Now, you may have heard the concept of universal design. While assistive technology refers to the technologies that are adapted to persons with disabilities specifically, universal design refers to those designs that make environments, products and systems accessible to the widest range of people. So for instance, if we speak about a ramp is not just something that will help a wheelchair user. It is also something that may help an elderly person. It may help a pregnant lady who may have difficulty in mounting the stairs. It may help a student who's coming back from, their holidays and coming back to the hostel with a very heavy bag. So universal design, basically, as the term suggests, refers to those designs which are accessible to the largest number of people. And naturally, if you have universal design, it is going to benefit persons with disabilities a great deal. So we look at universal designs at the workplace. We look at the way in which workplaces can be adapted so that persons with disabilities can experience the maximum amount of comfort and the minimum amount of difficulty. And this, of course, is helpful to all employees, not just employees with disabilities. And speaking of changing workplaces, we know that in the post-COVID era, many new ways of working, online work, work from home, and so on, have become very much a part and parcel of our day-to-day lives. And how these new ways of working can also be made inclusive for persons with disabilities so that they are also incorporated into the world of work and employment. Units 9 and Units 10 are very important units because we actually look at the accommodations for persons with disabilities at the workplace. There are 2 units. Unit 9 looks at accommodations at the workplace for persons with physical and sensory disabilities. And Unit 10 looks at persons who have intellectual and developmental disabilities, what we term as neurodiversity in the current parlance. And here in both these units, we discuss in detail the concept of reasonable accommodation. Reasonable accommodation is a very, very important provision that is made by the law of the land as well as international treaties and declarations, which basically means that when a person has a disability, certain accommodations or certain modifications, certain concessions are very important so that that individual can function in an optimal manner. So in Unit 9, we actually discuss some of the important cases, some of the important legal cases wherein persons with disabilities fought for their rights for reasonable accommodation. And in Unit 10, like I mentioned, we look at persons with neurodevelopmental disabilities, mental health issues, and so on, and how these sets of disabilities, which were earlier thought as being something that disqualified persons from being employed at the workplace, are in fact these days being celebrated and welcomed. In fact, it is being recognized that persons with neurodiversities have certain skill sets which are in fact very, very beneficial in certain kinds of employments. The fourth and final unit of this course refers to legal and policy frameworks. Unit 11 looks at international conventions and frameworks. So specifically, we look at the way in which the disability discourse has evolved over the last 50 to 60 years. And specifically, we look at the very, very critical role of the United Nations Organization and its specialized agencies in this regard. So we look at the UNO's important human rights treaties. We speak very, very specifically about the United Nations Convention on the Rights of Persons with Disabilities, the UNCRPD, which was adopted in 2006. And India was one of the first countries, one of the earliest countries to ratify this particular convention. We speak of the work of the ILO, the work of the WHO, very importantly, and other related UN agencies, and the immense amount of work that they have done towards making disability an issue of human rights and speaking about disability in terms of the capacity of individuals to enjoy all the rights and all the benefits that any other individual in society does. And of course, with specific reference to accommodations at the workplace, the right to work, the way in which the workplace can become a comfortable and happy place for persons with disabilities. Unit 12 then looks at the Indian context. So in Unit 11, we discuss the global or the international declarations and pronouncements. Unit 12, we look specifically in the Indian context and at government schemes and initiatives for persons with disabilities. We consider the role of the state, the laws pertaining to persons with disabilities, and the various schemes and concessions. The Constitution, the Indian Constitution, is a document which ensures rights to all individuals irrespective of their physical and mental conditions, and is a very, very important document which ensures rights to all Indians, including persons with disabilities. And specifically, we discuss the Rights of Persons with Disabilities Act 2016, which is India's rights-based law, which really is in sync with or is in tune with the United Nations Convention on the Rights of Persons with Disabilities. Unit 13, which is the final unit of the block and of the course, pertains to skill development and empowerment of persons with disabilities. And here we discuss in detail the importance of skill development for persons with disabilities. As you know, the government of India has placed a great deal of emphasis on skill development, including skill development for persons with disabilities, and we discuss the best practices and success stories. So with this, I think we have given an overview of the essential components of this course, a unit-wise breakup of some of the topics we've covered. And Dr. Sushmitha, I'd like to mention that in the making of this course, we have made extensive use of all the very, very important international documents, international studies that have been done by the WHO, by the International Labour Organization, and so on. So we've tried to bring to the student the crux of the work that has been done internationally as well as in the Indian context, and try to present it in a manner that will enable them to understand why it is so important for disability to become a very, very important component at the workplace, and how their sensitivity towards disability can be enhanced by this course.
Thank you, Professor Shubhangi, for giving a very detailed outline of the structure and the contents of this new course. With the course code MEVE-005, Disability Studies and Occupation Health. And here you have mentioned right from the definition of disability and why the subject is important, the discipline is important, and the occupational hazards and the results that lead to the disabilities, and also persons with disabilities and how they could be coming into the inclusive and accessible workplaces. And a very good example that you said was the use of the ramps, which we do find in many of the shopping places and the institutions, and in certain other places there are also technologies which are not ramp at all times, for example in the buses, but then when it is required it is done. So these are all very good technologies that can assist even the normal people, and sometimes when we don't feel well or when we are faced with a situation. So I think these technologies also have been discussed very well, and as you said, the text is having a lot of the case studies and important international laws also globally and nationally in the Indian laws, and all the concessions and the schemes that are available. So I think overall this course has been prepared with the design and the development involving a lot of experts in this field. And totally this is a very interesting and important course relevant to this program, Environmental and Occupational Health. And thank you very much, ma'am, for this detailed session.
Thank you.
My dear learners, I hope you had a good understanding of the introduction to this new program, a new course. Thank you for your patient listening.
Thank you.